Hi guys. Okay, so in this video I'm going to teach you how to do a groin wrap.
Okay.
So for the groin wrap you're going to need a few things. Most important one is your groin wrap. This is just a mid-grade. You can get high quality. The economy one, it's okay, but honestly those ones are done after one use. So you want 4 to 6 inches. This is 6 inches in the length, and I believe it's 10 yards. So you need to make sure that you get the proper sizing, whether they're a smaller person like me or someone bigger like a football player. Okay? Also need elastic tape. So my preference is I like using Light Fast Pro. It's not super expensive, and it's got a good stretch to it. So depending on the size of the person, you might need 2 inches or 3 inches. 3 inches is just for the bigger people. You got to cover up more. And remember, rule of thumb for taping is you always have to overlap the tape when you're placing it down by half, okay? And to make tape stronger, when you rip it and rub it in place, you're now adding to the strength and the stability of that tape. And then lastly, you're going to use some athletic tape to hold this in place, because you just got to make sure it's secured and it doesn't come undone.
The groin wrap is not going to feel like a splint or a cast. It's going to actually help you to keep moving. So if your muscle can go to like this range, and you find just about here is where you kind of feel pain, we're going to wrap you up just before you feel the pain. So this is the pain-free area, and this is where the pain is. So if we can just allow you to go within the pain-free area, you can still keep up, do your activity, enjoy yourself, have fun, and not worry about making things worse when you're trying to do this. So if they have compression shorts, that's amazing, great. That'll make it easy. If they don't, that's okay. We're gonna do this on top of the shorts. It is best to be on top of or against the skin as close as you can for any splinting taping. It's compression shorts is probably the easiest, so it won't slide and move too much. So now, before we start everything, you do need actually one more roll of tape instead of just the 2 rolls I mentioned. And the reason for that is, if you can find like one of the ends that you have, this is what we call it an end roll, because it's just kind of the last little bit. And all you're gonna do is I'm gonna wrap up this hip. So you're just going to take this roll and you're gonna get the person to lift up their heel. Then you're gonna put the roll underneath their heel. And let me get them over. So we're gonna make the muscle nice and big. We're gonna prevent hip A deduction, so in here. So we're gonna start with, we're gonna give support to that side. So we're going to place the tensor right here. We're gonna anchor it on first. Oops, sorry, they're a little bit longer. If you can always ask the patient to hold it in place. Okay. And so now what we're gonna do is we're gonna wrap around the hip. We're gonna come in, so go around the hip. We're going to come underneath, so we're gonna go over, under, through the leg, come back up. So you can just give a little bit of extra pull right here, wrap around. Hold that here. Thanks. Okay, so when you get to this point, this is where you're going to take your elastic tape, and you're going to place this on wherever the tape ended. So it ended in the back, unfortunately, here. So I'm stronger than I look. Can you hold this here for a second? Perfect. So now what we're going to do, nope, just shift over. Okay, so now we're going to come around. And we're going to wrap the tape all around them in that figure of 8. I'll do the second one from the front so you guys can see it better. Nope, shift your weight over. There. This is her. Alright, so we're going to come under, overlap by half the best you can without making it super uncomfortable for the person. I'm at the end of my tape. Sure, so why not? Gonna make sure this stays put. I'm gonna do it one more time just so, because the tape came undone at the end there, so we'll just pretend, okay? Okay, come underneath. Generally, you only need to do this twice around. Come back over here for your weight. And then we just take our athletic tape, rip off about like 3 inches worth, place down like so. And you have to rub down the tape just to make sure it stays in place. And if the person's not comfortable, get them to rub down the tape for themselves. Just go from inside to outside, okay? And so you just get them to step down. So for this one, I wrap the athlete to help with an inner thigh, inner groin strain, so the hip adduction. So when they try to bring their leg inwards, they're not allowed to. So that's what the tape that's what the wrap is doing. It's preventing them from going completely inwards to allow them to keep moving and doing what they need to. So if you were a soccer athlete, you would bring your leg inwards and kick in just like so, but you wouldn't go the full range. That would cause you discomfort or pain. So there are, compression shorts. You can definitely wear that, and you can double up by having the wrap on top of the compression shorts, and that's great. But honestly, the best thing is as close as you can, and also so it doesn't feel so excessive and too much material. So best of luck, have fun, bye guys.